So I'm recording this for my anatomy and physiology class. I don't think I was present for the day in which we discussed methods, and that was part of my PowerPoint presentation, so I'm trying to record that, just to be on the safe side, kind of get a grade and whatnot. My group, we presented on aquaporins and age-related skin dryness, and it's kind of hard to record on my phone with my computer sitting here, but I'm going to do the best I can. My part was on methods. So, in terms of methods, everything was held to a certain standard. The animals in treatment were held to a standard due to ethics and, keeping suffering at a minimum. So, the animals used in this were mice. The mice were kept at a room temperature around 24 degrees Celsius. They were given around 5% humidity, which is relatively dry air, comfortable air, and they were given about 12 hours of artificial light daily. The mice were hairless mice. HR-1 is their breed, and they were purchased at 2 months old and bred, up to 3 months or 20 months to be used in this study. They were then anesthetized, and their skin organs, or their body organs, such as the skin, kidney, large and small intestines, liver, and eye, were removed and frozen in liquid nitrogen and kept at a constant temperature of negative 30 degrees Celsius. So the animals were in very little to no pain during this procedure, which kept suffering at a minimum. So for the first experiment they did was TEWL, and dermal water content standardization. TEWL is transepidermal water loss, which was how much water you're losing through your epidermis, whereas the dermal water content is how much water your epidermis is keeping in. These were measured through a tuometer, TEW 300, which is basically like a wand you run across your face and it tells you how much water you're losing. And then the dermal content was measured using a corneometer CM825, which is almost the same thing. It just measures the hydration of your skin. So next was the real-time RT-PCR, or real-time polymerase chain reaction standardization, which was measured for the mRNA expression level of aquaporins. This was really important because it had to be done in a certain way to get the correct mRNA levels. So RNA was removed using a TRI reagent, and then the extracted RNA was used in a cDNA synthesis that synthesized 1 microgram of RNA, which is a really small amount. And then the set of primer sequences that is on this table was followed for the expression and levels and the beta-actin gene expression in the aquaporin, or AQP3. Then they used the immunoblotting preparation, which is kind of how you take pictures of microscopes and whatnot. So this had to be done a certain way as well. The skin that was blotted was homogenized in dissecting buffer made up of multiple solutions: sucrose, imidazole, ethylene diamine tetracetic acid, lupeptin, and phenylmethyl sulfonyl fluoride, and kept at a pH of 7.2. This solution was then centrifuged, which is when it's put in immense pressure, for 15 minutes at 4 degrees Celsius, removed, and centrifuged for 60 minutes at 4 degrees Celsius again. They then did the electrophoresis, which is when you look at macromolecules under a microscope. So the proteins were separated, and they responded to primary and secondary antibodies. These proteins and antibodies were highlighted using an electrochemiluminescence priming reagent and visualized using emitting lumino image analyzer. And the aquaporin 3 was obviously analyzed separately. Finally, we had the immunohistochemistry standards, which is, again, the electrophoresis, like the little, luminescent pictures of molecules, cells, and all of that. Those were held to a certain degree as well. The skin, both the epidermis and dermis, were placed in a 4% paraformaldehyde solution and phosphate buffered saline, and the samples were embedded and then frozen and cut with a cryostat, which cuts frozen things in a very specific way. The samples reacted with an antibody, which was rabbit anti-rat AQP3, and these same samples then reacted with a donkey anti-rabbit IgG antibody and were observed under fluorescent microscope. Finally, the numbers were also held on a standard, which were statistical standards. They followed a mean plus or positive negative standard deviation, and differences of greater than 0.05 were statistically significant.